Now sex education, when to begin? Whether third standard or fifth standard or seventh standard, government is still debating. Actually the best time or the only time to begin sex education the moment child is born. Do you ever decide the date when will I start loving my child? The moment child is born, you start loving the child. To prepare the child or to teach the child about sexuality is loving your child. So it begins the moment child is born. He has not even learned any language. He has not even learned to turn. He doesn't even know that you are the mother and you are the father. But that is the time to start educating child about sexuality. And you will wonder how exactly to do that. A newborn child and sex education sounds little weird to some people. But how exactly to do that, I will give you a couple of examples. A child is born, mother is bathing the child, mother is wiping the child, mother is dressing up the child. And there is a bias in mother's mind about his sex organs or private parts or genitals, you can call anything. So that when she is wiping the child or bathing the child, she will touch him everywhere normally. But the moment she comes near the genitals, her touch changes because there is bias in her mind. Her touch becomes hesitant. She quickly wipes that part and moves on. And sometimes a male child can get a good erection, not that he is sexually aroused, and the mother sometimes even gets disturbed. I was just wiping that part and my child suddenly got an erection. Now such a young child cannot be getting any sexual thoughts and feelings. It is just a physical response, but the mothers get disturbed and then they hesitate to touch that. Now this little child who doesn't know the language, who doesn't know the even concept of mother and father, who cannot even make out the shapes that he is looking. His first time seeing the world of shapes and colors. Child doesn't know anything. He doesn't even know what sounds he is hearing, what is the meaning of them. All that the child can perceive is only the sensations on the body. How he is being touched. Child does not even know that where the body begins and where it ends. Child even doesn't know that how many parts he has. That he has 2 hands and 10 fingers is not known to him. He is still exploring his body. And in the process of exploring his body, when you are touching, these are the first signals child is getting. And when your touch starts telling the child that there are some parts of your body which are touched differently, you have already started creating a bias in that child's mind. Child's entire body is so beautiful. No need of hesitating. You need to clean the the entire body, all the parts of his body. So don't let your bias about the genitals affect how you touch your body, how you touch your child's body. Also, children are trying to explore their own body in the form of, very often you will see a child in this posture sucking his own toe. He is just trying to get introduced to his body. His entire body is orgasmic. He is enjoying. And he is extremely sensitive to how you are touching his body. That is why while touching the body of your child, touch it all over equally with same affection. Don't have bias in your own mind about his private part, because this is what exactly will transmit it to your own child. I am reminded of a case that a mother brought a child to me and said that there is a peculiar problem with my with the child, that every night he puts his hand inside his panty and holds his penis tightly and sleeps that way. And the moment I try to take his hand off, he starts screaming and crying and howling. So for half an hour, 45 minutes, he screams and cries with his eyes closed. And then he again falls asleep, but again he puts his hand inside and catches it. Is my child going to be a pervert? Mother is asking. Why is he holding him now for a child? To do that, I asked the mother a question. Is it that earlier when the child was just exploring, in the process of exploring one's body, might have touched his genitals? And have you stopped him from doing that? She said, yeah, he had that dirty habit. So I had slapped him. I had taken his hand away. Now what child got a signal that my mother seems to be against this organ. It's my organ, but she doesn't want me to touch. And every time I touch it, and I feel so good when I touch it, she takes my hand away. She seems to be against this part. Who knows, when I go to sleep, she will simply chop it off. So I need to protect myself. So he started, while falling asleep, holding his penis tight, that no one should touch it. And the moment mother is taking the hand away, he will say, that's right, I was right. Look, I'm asleep and she is doing something. And the child is crying. The whole experience is going to remain with the child in his unconscious only because the parent had a bias towards private parts or towards genitals. This is how we transmit. That is why I say the sex education begins the moment child is born. Allow child to explore his body. Even if he touches his genitals, there is nothing wrong. There is nothing sexual about it. You have a bias for that organ, child doesn't have. And he just wants to know his body. He doesn't even know how many parts he has. In the process of that, he is touching his body all over, he is feeling his body parts, and he has a right to touch even his genitals. There is nothing wrong. If you don't stop him or come in the way, probably he will move on. But if you come in the way, when he touches his toes, we say, it's so cute, we immediately take the picture. But the moment he touches the genitals, mother will put the mittens in his hands. And this bias gets transmitted. That is why sex education begins the moment the child is born. That's what I say.